Mr. Colleagues, honorable ministers, members of the press. Today, Federal Executive Council considered two memos related to the health and social welfare sector. In line with the President's aspiration to ensure that Nigerians get access to quality health services that they can afford, and for which we'll be making steady progress, FEC approved a contract of 10,299,000,000 naira for various products that are linked to enhancing the accessibility and affordability of health commodities, health services by Nigerians. The first category was the third-line antiretroviral drugs. A few weeks ago, we approved the first-line antiretroviral drugs. The second and third line, for those who are resistant, Nigeria is putting forth resources, almost 997 million naira worth of contract to procure the third-line antiretroviral drugs for those who are HIV infected. I believe you will understand the importance of this given the changes in the global health financing and moving towards more of domestic financing to allow Nigerians to continue on treatment that they require. The second category is the procurement that was approved for locally manufactured diagnostic kits for diabetes. Diabetes is a major issue in our country. It's among the fastest growing segment. We have lots of our population suffering from diabetes, and some are not even aware they have diabetes. In addition, we're having a local company for the first time, one of the first in the continent, who will manufacture these diagnostic test kits in Nigeria. This is a company based out in Lagos, which we had commissioned. It's a private company, but it's manufacturing here in Nigeria. So government is procuring the diagnostic kits, the on-point blood glucose monitoring system that is manufactured here in Nigeria. This is bringing to life the effort to unlock the healthcare value chain by encouraging local manufacturers. So federal government is procuring 2 billion naira worth of those diagnostic kits out of this total amount that I had mentioned. There will also be, in addition, point of the blood glucose monitoring devices, but anybody who has diabetes will know that they will have to monitor over time. So the devices are also being procured and they will be distributed. The health workers will be trained through primary health care centers and other facilities, and those commodities we believe will bring relief to many Nigerians who are poor and vulnerable and cannot otherwise afford it. So that's also what was approved by the Federal Executive Council. In addition, Mr. President had previously indicated that we need to have a medical relief program to lower the cost for other types of medical commodities. So antibiotics, antihypertensives, and anti-diabetic medications beyond the test kits. Those are also worth 4.5 billion naira, which will be procured and distributed to help lower the cost. These are also commodities that are manufactured by local manufacturers here in Nigeria. So we are beginning to pull the demand and patronize our local manufacturers. So that's one category of the approvals that the FEC did. The second approval was with one of our largest teaching hospitals. That's the Abubakar Tafawa Balewa University Teaching Hospital in Bauchi, for which the Federal Executive Council approved the procurement of a mobile X-ray machine and also the rehabilitation and equipping of a computerized tomography, a CAT scan, a 64-slice CT scan for that teaching hospital in the amount of, it's 2.1 billion in total for this hospital, so that the diagnostic services and the clinical care that Nigerians will receive in that hospital will be of the highest quality that we can make it, and it serves as a referral, not only in the state where it is located, but also in the region where it is located. So those are the two main items that the Federal Executive Council considered, which are in line with the transformation of Nigeria's health sector that Mr. President has been pursuing and we're relentlessly executing on. So I'll stop here. Thank you. I think Bloomberg's question, I think is a very good one. What we approved a few weeks ago was for the first and second line antiretroviral drugs. There are 3 of them in the pack. They're called tenofovir, lamivudine, and the lutrogavir. These are combination drugs because HIV as a virus also changes. And sometimes when you're on it and you miss a few doses, you can have resistance. And when you have resistance, the virus comes back and starts to undermine your immune system. So a select group of patients will require third-line antiretroviral drugs, which are higher level, which not everybody will get onto them. They are more expensive, and those are ritonavir and darunavir. Those are the ones that this FEC memo's approval includes them, so that we also provide for those who need the third-line antiretrovirals, they will get them. The first line and second line, the company that is here in Nigeria is contract manufacturing from the technology holder, which is an Indian company, with transfer technology, and this entity that is already manufacturing drugs here in Nigeria will manufacture. That's what we approved the last time. For these ones, the manufacturers are not in Nigeria, so we'll have to buy them because they are more selective antiretroviral drugs. But going forward, given the implications of the change in the global financing policy and the fact that we are stepping up using our domestic resources, government in 2025, we've had the approval to proceed with some of those medications for HIV, for TB, for malaria, and we'll prioritize those companies that are going to come and manufacture in Nigeria, even if at the moment they are not. But that there's an understanding that we'll buy from you, but then you transit, because it takes time for you to set up a plant, get the licensing requirements, NAFDAC, all of those elements, because we want to make sure that the standards are also kept, that the medications are safe and efficacious, even if they are manufactured here. So these are not things that you just wake up tomorrow and do by yourself. So we are combining the need to address the health needs of the population, the demand that we have, and public policy that is geared towards industrialization, so that we channel that demand by buying and encouraging those actors to come in. And so far, there are many companies that have expressed interest. Some are already doing it. It's not everything that outsiders will come and do. There are Nigerian local manufacturers of pharmaceuticals who are already manufacturing. You'll recall there was Java, which started a beta-lactam plant. They expanded to produce antibiotics, the ones that, let's say, GSK used to be producing. Now they're expanding to produce. So we need to protect those. We need to encourage them. We need to buy from them. For those that we don't have manufacturers here, or the manufacturers don't have the capacity, if there are others that are coming, whether they're from India, whether from China, whether from Brazil, because there are Brazilian companies that are actually gearing up to come. So let them set up the plant here, manufacture here, recruit our young ones, add economic value in our country, and produce what will be utilized in our country. And through the presidential initiative to unlock the healthcare value chain, already more than 77 different investment cases have been developed. And working in the Ministry of Industry, Trade and Investments, we are seeing steady progress in that direction, including medical textiles, diagnostic kits. The company that we're buying the glucose monitoring is the first in sub-Saharan Africa to manufacture locally the blood glucose test kits. It is a company in Lagos which we unveiled, but without us buying from them, they would not be able to sustain or deal with the competition that may be coming from other places. So we need to make that balance, and that's why we're channeling some of the government's resources to encourage the domestic manufacturers where they exist, and where they don't exist, encourage others to come and manufacture here, and so that we can distribute to Nigerians. And on the question of what does this pooled procurement of commodities that will be distributed to Nigerians mean? It's a relief program. As you can imagine, the quantum of resource is 4.5 billion. That's to buy antibiotics, antihypertensives, anti-diabetic drugs. And for a country of 230 million, where a large proportion of adults have hypertension and diabetes, government cannot buy for everyone and distribute free. The question is, who are the poorest and most vulnerable that go to primary healthcare centers and our hospitals cannot afford it? And it's a relief program, thanks to the empathy of Mr. President on the challenges that Nigerians are facing and his desire to lower the cost of pharmaceutical for those who cannot afford it. So this relief program will provide a subsidy for those commodities which will be delivered in those facilities. Those facilities cannot charge the population for those. In 2025, we're going to expand that through a medical relief program, which will be structured and much more broadly. This is out of the 2024 budget that started it, and we've seen the benefit, because there are many people who skip their antihypertensive drugs or anti-diabetic drugs because they've run out and they're struggling to get the resources. Now government is stepping up to see how can we bring relief to them in a targeted way. As we move to the next phase, those that will be brought under the medical relief program will be branded as well, because one of the issues is leakages, diversions, because if President Tinubu has approved and government has provided, what prevents some health worker diverting it? So we're putting eyes to ensure that, in fact, those who are poor, vulnerable, first we attend to them. We want to build a country where we are our brother and sister's keeper, and that differentiated level. There are others whose medications can be covered by health insurance, for instance. There are some who can cover from out-of-pocket payments. But these generic medications, we want to be sure that no Nigerian will face the challenge of a choice between whether I eat food or whether I buy my anti-diabetic medication. So we are taking, you might call, initial steps on a path to bring further relief to Nigerians, among other retinue of interventions that federal government is making to ensure that the well-being of Nigerian person is protected, is enhanced as much as we can within the limits of the resources that we have.